Juno Shin from the Benjamin Thomas Clinic in Seoul. It's really good to see you. What I want to share today is not just product lecture. Instead, I want to walk you through my clinical experience with the L'Oreal filler and my experience, what I call the detailed filler art for the Korean patient. What Korean want from the filler? To understand the Korean filler aesthetic, you first have to understand what Korean patients are afraid of. Look at the left side of this slide, the pillow face, chipmunk cheeks, sunset eye. These are not just unflattering description for Korean patient. Korean patient repeat a genuine fear about this feature. Korean patients come to my clinic not asking for the bigger lips or higher cheeks. They want something that nobody notices. Interestingly, the best filler result in the one that nobody notices. They want to look like themselves, just better. So everything I show you today is built around this goal. Let me briefly walk you through the 6 zones that define the Korean aesthetic filler practice. So first, 프리타사로 by Korean 애교살 filler. So a flat and under eye is perceived as tired or stern in Korea. So augmenting the 프리타사로 enlarge the apparent eye aperture and soften imperial scrosure and create a gentle baby face impression. Interestingly, this request is unique for the East Asian. You rarely hear it from the Western patient. Zone 2 is the deep plain temples. Prominent giant eyes in Asian make temporal hollowing look severe and sub-gigantic hollowing severe. So, and because the Korean patients are terrified of visible bumps, so I prefer the deep plain injection below the temples. So it gives a perfect smooth and natural complexity with a low pepper product. Before any needle approach the pre-tassel, every injector must understand this anatomy. The inferior medial papillary artery, the IMPA. It runs deep to the pre-tassel ocular muscle. This is our key boundary, so we must think about the muscle in the subdermal layer at all times. So what makes the IMPA uniquely dangerous is not just its location. It connects direct to the ophthalmic artery, so intravascular event here can affect the vision. Here is one of my pre-tassel calyx, L'Oreal number 2, 0.1 cc per size, so you can see the soft and the low, natural low appear to balance the low lid. The eye looks larger and the gaze looks warmer and nothing looks injected. So this is what the just 0.1 cc of the light product in the light plane can achieve. For temporal augmentation, my preference is the suprapagus posterior plane below the temporalis, direct on the ball. This protects us from the product displacement caused by the anticipatory movement and delivers smooth possible surface control. This patient had what I describe as a peanut face, so hollow temple with a heavy mid face. So I use the L'Oreal number 6, 260 in the temple and 160 in the deep pupil space, combine the aortic RF, the unipolar light frequency device, and sculptura. So this overview view shows the complete facial silhouette transformation with a single session. So another patient, the titanium laser plus the L'Oreal number 6, 2cc temple. So you can see the heaviness of the lower face is counteracted by restored upper lateral volume. The same approach with the aortite and hypertitanium, no bumps, no visual product, just smoother and more useful. You can see the lateral contour also more useful. So third part is the pupil shortening lips. So Korean patients no longer ask for the bigger lips, they ask for the shorter pupil. The pupil is one of the clearest marker of facial age. As we get older, it lengthens and the upper fluid load is high load. So what patient actually ask for when they say, I want a younger leads, is not they ask to just volume. It's the listage of a structure more useful to the lead proportion. So this slide shows apply the same principle to the older patient. The wide load is restored and volume border is defined. So Q2 appears shorter. So this one does not look like a filler, so it looks like a lip rejuvenation. So first part is the listal space. Dilated field, the less oil forward often lead to a puffy or unnatural looks during the facial expression. So targeting listal space is a structural foundation of the mid face. So as the maxilla reobserved with the aging, the space enlarged and the open tissue loose occurs. So by polarizing the listal space with the lower number 6, we restore that support from the below. So it falls up naturally and especially is fully preserved. So this patient, I use lower number 6 for the frequent space and 3cc for the ear and 4cc, just 1cc with the lower number 4 in the mid face. Before we continue, I need to share something important. You can see the cannula with the blue, you can see here. So that came from the patient slide before, doing the listal space injection with the 20 gauge cannula. It's cannula, not a needle. So the cannula, 20 gauge cannula is inner diameter is 0.64 millimeter, and facial articulation can be larger than that. So it means the cannula tip can enter the vessel. It happened in my clinic, it means that it can happen in your clinics. So please, I believe the cannula is leaks, but it does not mean it can eliminate the leaks. So please aspirate always and inject slowly always. So fifth part is the chin augmentation. So retrogenia is extraordinarily common in Korean structure. So when the chin recedes, the lower lip appears to protrude and lower face looks heavy. Korean patient is wanting a free line, a clean, tapered profile that balance the face without the surgery. So high frequency filler like the Dorian 6 can place the strut posteriorly and the cognition at the cognition, and it can achieve the objective like this. So this is the last part. This is maybe the most Asian-specific technique in my presentation. When ears are visible from the front, they create what I call the frame effect. The face appears smaller and more compact, like a big face illusion. So it shifts the visual focus horizontally, and the mid face appears shorter and more useful. So this is some actual case. Warrior number 6, 1.5 cc per ear, combined with laser and larger figure energy device. So the face looks more compact and younger without any direct mid face injection. So you can see here. But the ear is one of the highest risk site in facial aesthetic, and I want to be very tight about this. So posterior auricular artery has direct anatomical connection to the superficial artery, and from there to the oxygen artery. So you can see that right here, that you can see the photograph show the overfilled ear from the anatomic clinic. This patient came to me from the photo correction. So overfilling in this zone make the vascular risk more higher. So, but with the warrior number 6, just a small auricle can make some results. We don't need to inject like 7cc or 8cc. So just 1.5cc may be enough for the ear side. So now let's see what's the main procedure in this lecture. So angle south. So you can see the angle point as close to the lash line. And I've also just flexed the skin, and using the 27 gauge cannula, I placed just one thin set in each direction. So make one single point entry point. And using the 27 gauge cannula, I put the just thin thread over the filler. I usually use the lower number 2 and gel 1cc to the gel 15cc is might be enough. So usually I prefer twisting cannula here because even this is a superficial injection, the IFS barrier artery and its direct ophthalmic artery connection, so it can be the vascular risk make some hazardous vision. So I prefer cannula for this vision and using just one anti-inflammatory bidirectional retrograde method I prefer. So after injection, I usually check whether make the patient smile, and this particular helps you to figure out how much amount you inject. So in this procedure, I figure out the right side a little bit, the lack of volume. So I retouch again. So using the same entry point, usually the retouch is much more easier because the feeling already occupied, and so it makes some space, so it's much more easier. So again, add another thin thread with the twisting cannula. So after that, for here, the thread the picture is very important for the treatment as a whole. So this is really helpful to make the patient smile. So next one is a lip for space. I prefer the antiforeign lateral to the outer base. I prefer using the 3C gauge cannula. So wire number 6 is usually here. So you can check whether cannula tip the direct go inside what you just pass area. You can see that the outer base move. So after that, because I recommend aspirate the cannula before your injection because you can see my cannula filled with the blood, so it can be helpful to yours. So every injection, usually in this high risk region, I change my cannula every time. So please inject the cannula very gently. And this is here. The entry point is a single concha. So after anesthesia, I make the entry point using the needle. So using the needle, I make the hole. And using the left hand, because using the needle, I paint catalyze and I fill the needle tip using the left hand. After that, using the same entry point, I using the 20 gauge cannula. So put the cannula and check the cannula tip using the left hand. And please aspirate every time because here also have some vascular event can be happening here. So for using the lower number 6, I think usually in some Chinese paper they recommend inject here more than 7 to 8 cc. But in my experience, using the lower 6 because it's very high questionability, I think 1.5 cc might be enough. So you can make measure just 1.5 cc of the filler. So let's move to the lip filler. But for the lip fillers, actually the next lecture, Dr. Wu will show the detailed lip filler techniques. So I think that I will skip here. But briefly, I usually use both the 25 gauge cannula and the BD syringe. So using I make the 2 entry point. Using the cannula, I put the pulse lip technique, the fanning technique. And after that, the filled lip body using the cannula, and I put next I usually use move filler to the BD syringe, and I use the Russian silk style. So I will move this lip part because usually I use both method, but I think the doctor will introduce more detailed technique about the lip. So here are the result, immediate and post and after 3 weeks. But here is, I want to look carefully at some point. You can see that before, the patient mid-face was slightly long before the treatment. We did no direct medical length impression in this session, but you can see the mid-face of face shorter at the follow. Why? Because we addressed 4 special targets simultaneously. pre-tarsal wall and deep pupil space and lip and ear. So all of these four injections target the lip space directly, and then the combined it makes some optical effect, the project face that looks like a little bit shorter, more useful and more professional. So over also more obvious. We can see the leaf face a little bit longer, but after injection 4 point, we can see the leaf face looks more shorter. So this is a short video that demonstrates two zones. So I treat together the pre-tarsal low and the peri-orbital region. So as you saw, it's the same technique as before. The entry point at the lash line as close to the lash line, and just put the just thin thread using the 27-gauge cannula. And so using the single point and bidirectional retrograde method. Usually, sometimes it's very hard for the patient to open their eyes because it's helpful to see how much I inject in their area. When the patient close their eyes, it's very hard to find how to figure out how much I injected. And this is targeting pre-jugular space. I inject very small amount in here because excess amount usually some compensated some here lymphatic drainage. So usually the unwanted melanoma can happen. So after you inject the pre-jugular below the molar septum, using this one, I'm using the 25-gauge cannula and just small amount, 0.2 cc, and below the molar septum. If the volume is not enough, as Dr. Bob suggests, the deep nasolabial bed may be the good point for the injection. So this is targeting deep pupil space. So you will see the before and after. The frontal view of you can see the very natural. So this is when she smiles, you can see some filler like the tissue. So Apollo is a cardinal case. This patient received the pre-tarsal augmentation as well, so non-product, excessive volume. The result is heavy, dropping lowly, what we call sunset eye. The color show has worsened. The gaze looks tired. Apollo, you can see some tired face. This is exactly opposite our goal. So this is what happened when product selection and volume control failed simultaneously in this zone. So the lower zone is my patient, lawyer number 2 with a 0.16%. So you can see the no distance, no spread, no sunset eyes. Same. So closure the oblique at 3 months on a patient. So shape, volume, position identical to the day of the treatment. This is a full face filler. So pre-tarsal wall with a lawyer number 2 plus chin augmentation with a lawyer number 4, 2 cc and number 6, 1 cc. So you can see that after 3 months follow-up, the both joint fully stable and no touch up required. This is a real work during with the lawyer filler. So this is take-home message. So know what your patient is afraid of, not just what they want, and target the farthest space for the natural result. And question is of the lawyer filler is not a marketing term, it's your clinical requirement. So thank you for your.
Thank you very much, Dr. Shin, for getting through excellent techniques of the art and design